All right, so today we're talking about your glute, your butt muscles, your legs, your back muscles, things that you can do besides just actively stretching. You can use a foam roller. We have these in our office, and this is something patients go home with. I highly encourage this. If you get something like this, it's going to be probably painful in the beginning, and I'll show you why. You're going to be rolling out your muscles, so it's like kneading bread with a rolling pin, just working it out. And as you break over that tissue, that tension that builds up in the legs, the glutes, this is a primary problem for most people. Why? Because we sit, and as we talked about in previous videos, we sit, we compress, we tighten this up. This just gets rock hard tight. And when I'm doing adjustments and evaluations, if I touch there, probably 80% of the time, oh yeah, that hurts. Many times that locks up, it blocks the nerve, the sciatic nerve. The leg can go numb or tingle all the way to the foot. The part of the thigh, if you're only getting numbness here, that's the femoral nerve, comes out of the lumbar spine. So nerve tingling, numbness is a sign of nerve compression. It's important to get this body flowing, get the nerve flowing, because nerves supply life and healing. We're meant to be alive and healthy, not sick, degenerating, and dying at age 30, 40, 50 years old that we see in America, depending on loads of pharmaceuticals and surgeries for everything. We're having knee and hip replacements and shoulder replacements all the time. It's absurd. We need to stay healthy to avoid this. So I'm going to just walk through a couple basic exercises. If you get a foam roller, it usually comes with a series of exercises. I'll show you what I use, and I show my patients. It works dynamic, and there's a lot to build on that. So I always start with practical, powerful, and simple. If I overwhelm my patients, what happens is they see it and they go, I can't do it. So my workouts, I work out at least 4 to 5 days a week intense, and my workouts that I do, if I try to get my patients to do that, if they aren't exercising at all, it's too much. We have to start with where we are. No matter what level of fitness and age and ability, this can work for you and be dynamic. Let me show you. So you want to do this on the floor. Do not do this on a bench, not on your bed. It needs to be firm. The floor is easier so you don't fall off. You can start on your thighs, and you can see my feet come up. I'm in a plank position, and I just roll up and down my thigh. And the pain is tight muscle tissue. You want to do it about 5 to 10 times, depending on how much you can tolerate. And then you'll just start rotating around your body. You go to the side, the IT band, and you roll up and down the side. You roll over at about a 45-degree angle. I'm not on my back, I'm not sideways, to roll over the glute muscle, the bum muscle. And as you roll that out, you can see it's not far movement. It may be very painful, but what this is going to do is it's going to break up tension, allow for flexibility, blood flow, and healing. And then you go to your back. I'm going to small your back. And you just want to roll up and back. And when you do that several times, you'll roll your thighs, you'll roll the side, the glute, the back, and then go over to this glute, this side, the thighs. You can also roll the hamstrings. So there's many different versions of this. You can lay and let it on your belly and let your arms stretch out to open up the arm and back muscles. So there's a lot you can do, but those simple for your legs and glutes will open up a lot of blood flow, pull out some of the tension, and after the pain goes away, you'll thank me. But make sure you drink water when you're doing all this, because water is supplying nourishment in this area. If it's dry, it gets brittle. Water is nourishment. What do we do all day? We sit at a desk, we don't drink water, we get tight, brittle, and then if we try to do something, it hurts. But it hurts because it's tight. If you don't do it, these muscles will atrophy and become scarred. Scar tissue will develop. You won't have any flexibility. And as you age, parts will start to break down. And then you'll need a walker. And then you'll need your cane or a walker or a wheelchair. You need to avoid that. This is something you can do every day. You have something like this in your living room, put it under your couch. When you're watching TV, oh, let me do the foam roller. It only takes a few minutes. They don't cost much, and it's something you can do every day, several days a week. You could even have it at work. So you need to learn these strategies, start to apply them in your life, which can decrease pain, increase movement and healing, decrease doctor visits, decrease doctor payment, so you're not paying. This is just a fraction of what a doctor visit would be. If this could save you hundreds, if not thousands of dollars in medication, drugs, missed work, pain. Who wants to lay in bed all day with an ice pack on a Saturday when it's beautiful, or you want to do something with your kids? You need to become active to avoid a problem. If you're already in a state of problem, just start easing these exercises back in or into your life and watch the pain decrease and your healing increase. And again, subscribe to our Innate Life Facebook page. We give this information out like this all the time. Subscribe to our newsletter, and don't worry, we're not going to blast you with a bunch of emails. I only send out what's necessary. And also, if you need to get your back checked or your spine checked, we always have a special offer. Just click the offer, call the office, and I would love to help you and evaluate your spine, do very precise, detailed digital x-rays, see if there is a problem, what type of problem it is, and then we'll come up with some options and a game plan to not only correct it, but correct it and keep it healthy for a lifetime. So have an amazing day, and make sure you implement this immediately. If you need things like this, many stores have them online, we have them in our office as well. Just start utilizing these tools now before your problem gets too big.